In the U.S. each year, human metapneumovirus is associated with approximately 20,000 hospitalizations among children younger than 5 years old. It can also severely impact older adults and immunocompromised patients. Most people have a metapneumovirus infection by the age of 5 years. However, all ages are at risk for infection. The clinical presentation is usually mild and can include respiratory symptoms such as cough, fever, and nasal congestion. The symptoms are often clinically indistinguishable from infection with other common respiratory viruses such as flu and RSV. Human metapneumovirus infection can also progress to the lower respiratory tract and result in bronchiolitis and pneumonia. Metapneumovirus can be detected throughout the year, but infections typically peak in the U.S. from late winter to early spring. Notably, it co-circulates with RSV and flu during the respiratory virus season, but metapneumovirus activity generally peaks later in the winter than RSV and flu. Since human metapneumovirus is relatively new and not well described, healthcare professionals might not routinely test for it or even consider it in their differential diagnosis. But CDC recommends that clinicians should consider metapneumovirus testing along with flu, RSV, and other common respiratory viruses, especially in patients with severe respiratory illness. Test results can help identify possible etiologic pathogen and help guide available treatment. The most sensitive method for human metapneumovirus diagnosis is to test for respiratory specimens using polymerase chain reaction or PCR assays. Examples of respiratory specimens include upper specimens such as nasopharyngeal swab, oropharyngeal swab, and nasal wash, and lower specimens such as sputum, tracheal aspirate, and bronchoalveolar lavage. Patients with clinical or radiologic evidence of lower respiratory infection should have a lower respiratory specimen tested. Metapneumovirus is commonly included in commercial multipathogen PCR respiratory panels. Antigen detection assays are also available for diagnosing infection. Healthcare providers can contact their state health department for assistance with laboratory diagnostics or consultation. There is currently no vaccine, and antiviral treatment is not recommended. You can help your patients reduce their risk of respiratory illnesses caused by metapneumovirus and other pathogens by reminding them to wash their hands often and practice good hygiene habits.